Hi, I'm Dr. Karen Feeny, and today I want to talk about urinary tract infections, or UTIs. The urinary tract is made up of two kidneys, which are bean-shaped organs which filter the blood into urine. The urine is then stored in the bladder. There are two ureters which function to carry the urine from the kidneys to the bladder, and then the urethra, which carries the urine from the bladder to the outside of the body. An infection occurs when bacteria travel up the urethra and into the bladder. A kidney infection happens when the bacteria travel even higher up into the kidneys. Women are actually more apt to get kidney infections than men, and this is simply due to anatomy. The anal opening in women is closer to the urethra, and this allows bacteria sometimes to travel up the urethra and cause an infection. Some of the signs and symptoms of a urinary tract infection, specifically a bladder infection, include pain or burning with urination, the need to urinate more frequently, the need to urinate suddenly or in a hurry, or blood in the urine. Signs and symptoms of a kidney infection can also include fever, back pain, and sometimes nausea or vomiting. If you come to the clinic and we diagnose you with urinary tract infection, treatment involves antibiotics. For a simple bladder infection, this usually means about 3 to 5 days. And often the practitioner will also prescribe a pain medication for the bladder. If you're diagnosed with a kidney infection, however, the antibiotic treatment will usually be longer. Some patients often ask, why am I at risk for a urinary tract infection? Well, studies have shown that use of spermicidal jelly or cream, especially with a diaphragm, or spermicide-coated condoms can actually increase the risk. Therefore, if patients use these methods of birth control and have had frequent urinary tract infections, we will often advise them to use an alternative method of birth control. So, some of the other reasons that you can have a risk for a urinary tract infection include diabetes, obesity, and patients that have structural abnormalities of the urinary tract. Some of the things you can do to decrease your risk are urinating right after sex. But unfortunately, drinking large amounts of fluids or using cranberry juice or other cranberry products have really been not shown to be beneficial. So in summary, if you are diagnosed with a urinary tract infection, it's very important for you to take all the antibiotics. Most women or other patients that have a simple bladder infection will start to feel better within 1 to 2 days. So if you feel you have symptoms of either a urinary tract infection, kidney, or bladder, please feel free to come to any one of the GoHealth urgent cares and we'll be happy to see you.